Veterans Day, of course, is November 11th, and if you're 65 and over, you may be wondering, what are some things to consider when it comes to your health care? This segment sponsored by Humana. That's where our next guests come in. We've got Stephanie and JJ who are here to answer all of your questions. Stephanie and JJ, welcome.
Welcome. Thanks for being here.
Hi, thanks for having us.
Thank you very much.
Absolutely. Let's start with this question. When does the Medicare annual election period, when does that take place this year?
Sure. So the annual election period for Medicare Advantage and prescription drug plans takes place every year from October 15th through December 7th. So we're in the season. And during this time, those who are eligible for Medicare can review, compare all of the plans that are available in their area to find the one that best fits their personal health needs.
Absolutely. And then let's talk about, this can be kind of tricky for people.
Right.
I know it's something that, Jason, I know you and I think about every year when it's time to enroll for our families. What should we be keeping in mind when it's time to enroll?
Sure. So there's two things to keep in mind when choosing a Medicare Advantage plan. And the first is cost. So take the time to review your medical and healthcare expenses from the past year. Think about your budget. Think about your needs for the coming year so that you can make an informed decision when comparing those costs that are associated with each of the plans. And then the second thing to consider is, what kind of coverage is really important to your needs? Are your preferred physicians or hospitals within a plan's network? Will the plan cover your medications? Do they offer mail order? Healthcare is really personal. So what kind of coverage is most important to you?
Yeah.
Sure, Stephanie. What are the key things that veterans should be thinking about when they're evaluating their Medicare Advantage plans?
Sure. I mean, I think when you look at veterans, they have unique needs and unique benefits. So the first place to start is to look at what they have, like VA benefits. Compare that, as Stephanie was talking about, with what they need, what's important to them, because that's going to vary from person to person. And ultimately, I think it's really important that they talk to a licensed agent. Sometimes you don't know what you don't know. And those licensed agents can really help guide them based on the answers to those questions. What's important to me? What do I need? And what do I have in various plans? So speak to a licensed agent. I like to say Humana. Speak to a licensed agent at Humana, because at USAA we take the time to make sure that they get training that really spins them up on what's important to the veteran community.
Yeah, certainly. Thanks, JJ. And for people who don't know a lot about USAA, tell us a little bit about the company and its connection to the military.
Sure. We were founded 100 years ago. We celebrated our 100th birthday back in June by 25 Army officers. So we began serving that community, founded by that community, and we've really stayed true to those roots over the last 100 years.
Yeah, certainly. How can people find out if they're doctors and hospitals in the provider network, and maybe learn more about additional benefits?
Sure. So 1-800-MEDICARE or Medicare.gov are some great resources where folks can use the Medicare Plan Finder to compare plans and costs and benefits. There's also a physician finder there to ensure your doctors are in network for the plan that you're considering. And then the same is true for most private insurers. Like JJ mentioned, you could also reach out to a local licensed agent and connect over the phone or in person. They're a really great resource to help you navigate all the plan choices and answer any additional questions you might have.
Yeah, certainly. Well, is there an additional place we need to go to find more information, or is the website, that's the best spot?
The website really is the best spot, Medicare.gov.
Yeah, all right. Well, thank you both for joining us. Stephanie, JJ, we appreciate you. Thank you for bringing this to light. Yeah, great stuff there. Always informed.
Well, of course, open enrollment, very important. And so I just asked today, I was like, when is ours?
Yeah,
just to make sure that you don't miss it, because you just get used to kind of being in this motion. It's like, okay, it'll be fine. Then it comes around, and then it's like down to the wire,
missed it, right?
And you missed it, or you're just rushing through what your choices are.
I know.
You don't want to do that.
It's a great time to be asking those questions.
Yeah.
Thanks to Humana for sponsoring that segment.